former chair of the Health Select Committee and chair of the NHS Confederation, and with us as well is Dr. Ben White, an NHS doctor. Good afternoon to both of you.
Good afternoon.
Dr. Ben White, first of all, let's start with a man still at the coalface here. What do you make of what the IFS are saying, that we'll need to increase taxation by something around 4%?
Well, I think Anita Charlesworth and Paul Johnson's report is much needed. I think it leaves some parts out relating to the future of privatisation of the NHS and outsourcing, but I do agree, and it's very, very important to make clear that we need to rise to spend it by an average 3.3% a year for 15 years just to maintain provision. And that's to keep things as they are. And we know how things as they are not good at the moment.
So what's your expectation?
What's my expectation? Well, I mean, this government is woeful in their management of the NHS, and there seems to be enjoying the financial stress. The situation that's being created in the NHS of financial stress is naturally diverting care away from people that need it. And I don't see any sign at the moment of that being turned round. Hopefully we can find out that something, will prove us wrong. But
well, let me bring Stephen Dorrell in on this, because Stephen Dorrell, you operated for many years in the world of politics and still do in lots of ways. Is the political will, does it exist, the political will to retain the NHS as we understand it, free at the point of use, largely funded by taxation? Is the political will for that absolutely intact in your view? Because there's an awful lot of suspicion that the answer to that question is no.
I think that the truth is that there are two elements of political will here. Is there a political desire to change the free funding basis of the NHS? I do think the answer to that question is a straight no. I do not think there is any will to do that. But there's a further question. It's not enough just to say on a public platform we're in favour of the free NHS. What we then have to do is to work out what that means in practice, against the background of the factors that you set out in your introduction. Because it's no good just making a speech saying you're in favour of the free NHS without working out what it means to deliver it to the standards that we all want for ourselves and for our families. And that's why the NHS Confederation, which I chair, didn't just produce another report from the NHS saying it needs more money, but asked the Institute of Fiscal Studies, which is, I think, the most trusted independent economic analysis organisation around, certainly very well trusted by the Treasury, which is important in this debate, and also the Health Foundation, which is an independent specialist think tank on healthcare and the health system generally, to produce not just totting up the sums as to what would be nice to have, but actually analyse the trends, look at the facts, in order precisely to challenge the question you put to me: are you willing not just to make the speech, but to make the choices necessary to make the speech real?
And Dr. Ben White, and do feel free just to come in on this, Stephen Dorrell. Dr. Ben White, you said at the very beginning there that even just to retain the status quo, we need 3-point-something%. But the status quo, you say, is what, almost disastrous in parts.
Yeah, and that's why in the summary of the report they state that really 4% rises minimum are needed in order to catch up on the backlog. But I'd just like to come up, speak on a point that Stephen just made. I think MPs need to be responsible in what they promise regarding the NHS, as a healthcare professional would in the care they would promise a patient. And if you look back at David Cameron's government, they got elected on a 7-day NHS pledge, which had never been thought through, never been planned, never been costed, and the public were led to believe that's what they would get, when in reality what they were always going to get, of course, was a shrinkage. And that's a real lesson going forward for any future government.
Do we all, Stephen Dorrell, politicians and public alike, need to readjust our expectations of the NHS and perhaps our own part in our own health? Is that part of this picture?
I think it is part of the picture. I mean, I think that what we have to do is to take this piece of independent analysis and say, as Ben says, I mean, the really startling statistic, I think, is that in order not just to continue as we are, but to catch up with the backlog and also reflect the fact that most of us in every country in the world, there's a desire not just to do as we do now, but to do things better. The figure, the really startling figure in this report, is that for the next 5 years, it needs to be 5% real increases year on year on year. That's a higher figure than I've seen in any of the commentary here. And again, I emphasize, produced by people working in the NHS or people who might be thought to have an interest, but by independent economists sitting back and looking at the facts.
And Dr. Ben White, what would that catch-up look like as far as you're concerned? You know, what needs to improve? Staffing levels, top of that list, are they?
Well, I think they speak about staffing and employment of staff, different staff groups being the top most important, and that's the way you increase your productivity. And by the way, the NHS is very productive, if you want to talk in industry terms, as they outline in the report as well. But I think where does it need to get to? It needs to get to prevention, and that means public health, and it needs to get to where it's desperately needed in general practice and the front line. And just funding any one of those areas would not be sufficient. You'd need to increase funding in all of those areas, because if you just funded one area, you'll find, you won't balance it enough, and there'll still be an area which will be the bottleneck.
And just a word on prevention, because it seems to me in my almost 30 years of discussing the NHS in journalism, prevention always seems like an echo of the conversation, and it really needs to be central to the conversation, doesn't it, if money is tight?
Yeah, but I think it speaks to the way that politicians find it difficult to come up with long plans, like 25-year plans. That they find it easy to come up with 5-year plans, and vaccine programs or stop smoking programs or diet and exercise type programs. Any of these things which may well be evidence-based and may have huge benefits in the long term, it's very difficult for them to show, oh, I've done this in the short term, but we need those long-term plans, and you need to commit long-term money to those plans for them to have a lasting effect.
Stephen Dorrell, on that point of longer-term thinking.
Well, I agree with Ben about that. I think it's interesting, isn't it, how the moment we think we're going to talk about health policy, and what we end up doing is talking about hospitals and doctors and so forth. Now, Ben and his professional colleagues are immensely important people, but actually successful health policy is, as you quite rightly say, about prevention, about taking opportunities to support people so that they don't need to be in hospital or indeed in a doctor's surgery or in a care home.
Or are less likely to get ill as well.
Precisely. And so often this is expressed as being, and therefore you save money on hospitals. But surely that misses the point completely. But the point of health policy is to enable and support people in leading longer, not merely longer lives, which modern medicine does provide, but more enjoyable, more rewarding lives and healthier lives.
But that brings in a lot more than just health, doesn't it? Jobs, services, public services, housing, and any government, with this government you could point to austerity, but any government has its challenges on those issues that on the surface of it have no relation to health, but are absolutely wedded to health.
Well, that's something that, from the NHS Confederation, it's something that we've been seeking to develop, in particular with the Local Government Association. When the NHS, today what we're doing is looking at the funding of the NHS in order to deliver the kind of health and social care interventions that are necessary to deliver proper health policy. But it cannot be seen in divorce from, in particular, housing policy and a range of other public services that meet the needs of local communities, which is why I think it's important that the health service is seen as part of the full range of public services rather than as something special from them.
Well, the siren in the background is a good sound effect to go with our conversation. Just a final thought from you, Dr. Ben White. This report says we need consensus.